Hi, I'm Bobby Peterson, and I'm with Anna Kaminsky, and we're giving a presentation today on how to amplify the possible in building your local HealthWatch Coalition. Hi, Anna.
Hi, I'm Anna Kaminsky. I've been helping coordinate the Dane County HealthWatch Coalition for the past 4.5 years. So that's what I'm here to
So we're
share.
going to give you some of our insights, wisdom, ideas that we've used and have been successful with other coalitions, but a lot of flexibility here. Part of what we need to start out with is thinking about your local coalition. Could be an existing coalition or starting a new one, but what's your mission and vision? So we're trying to create a local forum to network problems and really focused on access to healthcare and coverage issues. A lot of things can vary from that, but that really seems to be the best way to focus it. There's a lot of issues out there for low-income people, and we try to refer others to other places, but access to healthcare and coverage is our area of expertise, and we want to bring people to the table to help problem solve and think of solutions. So identifying system issues, education, collaboration, it really is an opportunity on a monthly or bi-monthly basis to get some ideas, be creative, and come up with some strategies to help people. So we focus on access to healthcare and coverage. We try to offer coordinated support, teaching, and training. And a lot of it is what's causing the trouble? What are the pain points for the consumers, some of the service providers out there? What are the problems that people face? And so Anna's been working on some of those issues with HealthWatch Wisconsin over the years.
Yep.
Part of it is strategic planning and partnerships. So when you're thinking about getting a new coalition or revitalizing your coalition, you got to find the folks that are going to be willing to work together, be passionate. Think about a planning team that can help sit down with you, identify some of your strengths and weaknesses. We'll talk a little bit about asset mapping and some of the other resources. You know, the history of this goes way back. HealthWatch began in the late 1980s, and it was the first opportunity to respond to large government program changes, which in those days were the first, the start of the HMOs in Milwaukee. And we began the HealthWatch Coalition in Milwaukee, and it started with a very weird name, the Preferred Enrollment Quality Initiative, and luckily that changed. But it was an opportunity to get together with key stakeholders to think and strategize what can we do in response. Because if we can, focus and amplify our voices together, we're stronger together. And so that's part of the theory behind HealthWatch.
And some of the stakeholders will change over the years. I know you've talked about how the HMO providers in the past were sort of seen as the enemy at one point in time, and now they're a key part of the Dane County HealthWatch Coalition.
Right. We didn't want them at the table. We didn't want the county or the consortium at the table. We were thinking that that's the people that we were opposed to. But bringing them in, collaborating, and identifying and aligning visions for how we could move forward is helpful. We don't always agree, but we have to try and operate in an atmosphere of mutual respect so we can debate the issues and then agree to disagree on certain issues. So part of it is looking at, for your local coalition, what's the strategic needs that you have in your community? What is your community? Is it one county, multiple counties, one community? It really can vary quite a bit. And what are the access to care and coverage issues that families face? And a good place is to talk to the families that are having trouble. Is it immigrant families? Is it low-income populations that are rural and isolated? Is it urban minorities that are facing real problems and certain policies that are causing the barriers? So what are the opportunities out there to reach the families and to be able to connect with them? So a lot of it is strategic planning and partnerships and issue spotting. Look at the record of your community and how can you address some of those issues. Who are the key people you're going to be bringing in? And again, as Anna said, it might be new people over the years. And don't be afraid to think outside the box. Bring people in that have something to contribute, but also make sure you're providing value to them. What are some of the things that you do at the Dane County HealthWatch Coalition to help keep people involved?
We do a variety of different things in Dane County. The Dane County HealthWatch Coalition meets monthly, which I think some of the coalitions don't meet as frequently. We meet monthly, except that we also take a break in the summertime to have a picnic to escape from the work-related stuff and kind of get to know each other a little bit better that way. During the meetings, we try to have a pretty a straightforward agenda, which we'll talk a little bit about, where we bring in speaker topics that the group helps decide on. The group and the steering committee help decide the topics. And then we do other things to keep people engaged, like we have a strategic planning meeting once a year. with food and coffee.
That helps.
And we'll do an item drive in the springtime and a food drive in the fall that helps keep people engaged.
Right, so you have a steering committee that takes a little bit of the burden off the overall group, because you do some strategic thinking ahead of the meeting and get things organized for the meeting and think about speakers that are going to be coming up. So that really helps. That planning pays dividends and for an effective meeting.
Yep.
We've got a couple of the coalitions listed up here that we work with in different areas of focus. You know, Anna talked about Dane County. Milwaukee County has gone through a variety of iterations at points, and they're actually going through another period of growth and refocus. Chippewa County works on children and youth with special health care needs quite a bit. They have soup, or they used to have soup at every meeting and snack. Over the lunch hour, they tried to make it accessible for parents. And then Polk County has a HealthWatch Light group, but it's really focusing on mental health, behavioral health issues. So the focus can be different depending on where you are and what issues emerge in the community. But making sure you're responding to the needs of the folks out there that need the help, the service provider community, and helping to be a sounding board for issues and strategy sessions to help think about change. So one of the things is keeping current. You know, and if you don't have your finger on the pulse, if you're thinking about issues that were 10 or 20 years ago, that people are going to stop coming to the meetings. But it's an opportunity to learn from each other, discuss the issues, and speak up about the issues that you're concerned about. So things that you might just complain about, you can actually focus and think about, hey, what can we do about it? And one of the things I think we always talk about is that we want to try to think about ways that we can accomplish, have an accomplishment at HealthWatch. If we try to do something too big, like change the entire health system, that might be a long-term goal. But the short term, we're not going to do it in that year. So we think of some short-term policy changes that we can work on.
And sometimes it's local stuff too that you're working on that may not be, well, probably is an issue across the state, which is I think why we have our local coalitions calls, where leadership from all of the different coalitions get together and talk about what they're seeing. But sometimes there's an issue that we can really dig into and really make an impact on locally. So that's something that we'll focus on.
Right, and that's a good point, Anna, that we have supportive services available through HealthWatch Wisconsin. We've got a lot of videos, teaching, training, local coalition calls, the annual conference. We do a couple of workshops. These are all opportunities for teaching, training, and support to help you and local coalition members have a better idea of what some of the issues that other people are facing. So use that local coalition call to bounce some ideas off your colleagues around the state. Get some input from ABC and HealthWatch staff because we're here to provide some help. So thinking about the next steps, identify your point person, who's going to be taking minutes and who's going to be helping to put that agenda together that Anna talked about. Talk a little bit about the agenda process.
The agenda process is something that, what we found is that it's helpful to have an agenda. It helps welcome in new people that are trying to, come into this meeting that everybody knows each other, and it helps them to kind of understand what to expect and what's going to come next. It also helps just, our regular attendees, our regular members, to know when they can, give their announcements, or when to save, questions if there's somebody that's going to be coming up a little bit later about that. But it's good to have a regular agenda. We try to keep it, and I can go into the Dane County Health Watch one, we try to keep it pretty straightforward with introductions and announcements, where everybody goes around and does an introduction for the new people and for the, continuing people. We review the minutes. That's a regular thing that we do to make sure that we're accurately, communicating that information.
And some people might say, oh, I want that taken out of the minutes, or this wasn't quite what I meant when I said this, but that allows them to clear the record and make sure it's reflecting what they really intended to say.
Exactly. And then afterwards, we'll jump into the speaker topic. We always have a speaker topic that, again, is focused around our area of focus, which is access to healthcare and coverage. And that's something that sometimes we'll get somebody talking about something a little bit different, as long as it relates back to that overall goal.
So those are some good process issues to make sure, you have a well-run meeting and minutes, and, do you have the right people at the table? I mean, as you're looking at reinvigorating your coalition or building one from scratch, part of it is the asset map. What's in your community? Who's out there? And this could be a session that you convene to really help identify who are the folks that should be there, who from the consortium, others from public health, children and youth with special health care needs, the ADRC, maybe someone from the food pantries that are working with low-income people that see health issues or access to health care and coverage issues, the librarian, faith community. There's a wide network of people that are concerned about access to health care and coverage. Get them to the table, help start the process of thinking about prioritizing what are the key issues and how can you make some accomplishments.
Yep.
So you've got your asset map, you've got the right people to the table. Do they have the skill? Do you have the organization? Do you have the skill sets to be able to continue meeting? Do you have sustainability? Do you have strong enough interest? Do you have space? A good location. We talked about food and coffee. My motto is no coffee, no worky. But it's important. The little things make a meeting a little more pleasant, and I think those are the steps that you can take. Find out someone who might be able to donate some coffee for the meeting, or bagels, or maybe some healthy fruit. We're always trying to think about ways to bring in healthy snacks here at ABC for Health. Doesn't always work. But think what you can do to help your physical space for your meeting, and to create a welcoming environment for the old timers and the new people coming in.
And make sure to thank the people that are helping you get there too. Thank the people that are offering you the space or donating bagels or coffee or whatever it may be.
So if you're reinvigorating your coalition, you might be thinking about new groups to reach out to, tap into your members, have a member bring someone along. We talked a little about making sure you orient them correctly, welcome them to the new meeting, make sure they get an idea of what the mission and vision of your coalition is. Dane County actually has like bylaws and sort of operating procedures. So it's a little bit more detailed, but it specifically says no Robert's Rules of Order, because they didn't want that to be overly formalized.
Yep.
So there's some process and procedure, but in my experience too in time is that if there's anything that's going to kill a coalition, it's just heavy process. You just process. You can never get to the issues that people come to meetings for, which is to learn and to be able to develop an action plan. So keep that in mind. Spending time on process or topics that don't relate to your access to health care, although they may be important, someone might be passionate about it, it can defeat the purpose. What are some of the things that Dane County does to try and capture that passion, but to help to focus an issue in a way?
Well, sometimes we've broken off into subcommittees. Subcommittees are a great way to say, hey, we've got a lot of energy and desire to impact and improve the situation for dental health, for example, dental access to dental care in Dane County. That's been a big issue that we've had over the years for quite a while. It's nice to form a subcommittee to do some research, find out what is it that we could do, what's already happening, and then report back to the group. It's a great way to, again, build that leadership within the coalition as well, while we're focusing on a subject a little bit off the regular time, so that it's not taking up everybody's time, but instead.
I think that's a real effective strategy, and I think that we've thought about that too in terms of how can we capture that passion, but not necessarily make it the main focus of the meeting. So if someone is really concerned and passionate and wants to raise a lot of issues around the behavioral health issue, which is really important. It might be a great subcommittee because it's a tremendous problem across the state. But there are also public health issues, maternal and child health issues, children, youth, and special health care needs. So those are some areas that might be good to have a subcommittee that reports on it, so that you have that lead person in that subcommittee that really is passionate about it and can keep the coalition going. So we talked about best practices, steering committee, welcoming new folks, advertise meetings in advance, have that meeting agenda, and make sure you stay organized. Is someone keeping those minutes? Is someone preparing them for people to review in advance? Do you have your handouts organized? Do you have space with parking? Parking is always key. People will come to a meeting if they have to, struggle for a half hour for parking. They might not want to show up. And then, thanking the people that help donate space or provide space to you with the parking lot. It's always really helpful. So, good agenda items,
Yeah, the agenda, again, going back to reiterate, this is one of the essentials, I think, of a productive meeting is to really have it focused in that way. And we'll be able to send out some samples, too, of what an agenda might look like, depending on, each individual coalition's needs. But it's good to, have agency reporting. So we have regular reports from the Capital Consortium.
Yeah.
The county worker comes and does that. We have regular report from the Aging and Disability Resource Center, regular report from ABC for Health as well, HealthWatch. We've always got a lot to talk about. And then, opportunities under the coalition maintenance to report back on subcommittees or other things like that.
Yeah, and then also making sure that you frame expectations. This is why a steering committee is helpful, because the reports should not be more than 5 or 10 minutes. Because if someone comes in and gives a report, the agency report that takes up the whole meeting, it's really time management and effective use of your meeting time. So we usually, the Dane County Health Watch is about an hour and a half.
Yeah, it's an hour and a half to 2 hours, but really that depends on the presenter for that meeting, the person that we're inviting in to give a speech to.
Right. So think about
Or
when you're
for.
going to have your meeting as well. I mean, we do it every, it's been routine now. We do it Monday mornings. The first Monday of the month begins at 9, typically to about 11. But other coalitions do it over the lunch hour, other times. What's going to work best for getting the most people at your meeting? So some reminders, stay organized, stay focused, meeting agendas, minutes, welcome the new folks, keep bringing in new blood to your meeting.
And
Capture the
thank the
passion.
existing members as well. It's
That's right.
good to keep that up.
Celebrate, and lean on HealthWatch Wisconsin. Let us know what we can do to help you keep your coalition going or to get a new one going, because we're here to help. We've got a lot of ideas. We've got some toolkits, some asset mapping tips and tools to help you to pull those things together so we can provide a lot of help. But thank you for your attention. We want to really support HealthWatch coalitions across the state, new, emerging, and existing. Let us know how we can help.
Thank you.
Bye-bye.